So I'm going to be doing cranial nerves. I'm going to be testing cranial nerves on my patient, and I'm just going to go ahead and get cranial nerve number 8 out of the way, and that's going to be your acoustic nerve, and that's testing acoustic nerve. And we can, to test that nerve, we can perform the whisper test. I can have my patient cover the ear, and I can whisper something like apple and have him repeat it back to me, or I could cover the other ear like this one and stand on this side of the patient and whisper something completely different like truck, and have the patient tell me what I whispered into his ear. I can also go like this and see if my patient can hear my 2 fingers rubbing. For cranial nerve number 1, it's just olfactory, which is the smell. You're going to be testing for smell. You're going to have like I could like have like a peppermint aroma and just have him breathe it and see if he can tell me what he can smell. For cranial nerve number 2, which is optic, I can perform the Snellen chart, or I can cover one eye and go like this. See if he can tell me how many fingers I'm holding up. That's testing cranial nerve number 2, which is optic. Cranial nerve number 3, 4, and 6, I can test by doing the 6 field of gaze, cardinal 6 field of gaze. And cranial nerve number 3 would be testing going upward, and that is the oculomotor nerve. Then we come back in the middle, and then we go outward like this, and that's testing cranial nerve number 6, abducens. And then we go downward, and that's testing cranial nerve number 4, trochlear. And of course I can also do the other side as well. Go up, test for 3, test for 6, and test for 4. Cranial nerve number 5, which is trigeminal. I have my patient close his eyes and like put like a cotton ball maybe on his face, and see if he can detect that and tell me that it's something soft, or I can use like something hard or firm to see if he can distinguish the types of items I'm putting on his face. I can also check the mandibular joint here by having my patient close his mouth and assess if there's the popping noise or not. For cranial nerve number 6, we already discussed, which is abducens. Cranial nerve number 7, which is facial, I could assess that by having my patient raise his eyebrows, smile, puff cheeks. We already covered cranial nerve number 8, and cranial nerve number 9, which is the glossopharyngeal nerve. I'm going to check to see if the uvula is midline, and then I'm going to push this downward to see if my patient has a gag reflex, and that's tested for cranial nerve number 10, which is the vagus nerve. Cranial nerve number 11 is the spinal accessory nerve. What I can do to assess this is put pressure on his clavicle bone and have him shrug his shoulders to see if we can do it against resistance. And cranial nerve number 12, which is the hypoglossal nerve, I can have my patient see if he can move his tongue either upward, downward, and side by side, left or right. And that has completed my assessment on the cranial nerves.